I'm Dr. Rebecca Bowers, and in this video I will be discussing Elaine Wallace DO's torque balance points, how I locate them, and my novel approach to treating them, which is super easy and super quick. But first we need to discuss a little bit of physics. Torque is a type of turning or twisting force that tends to produce rotation or torsion, and the word is commonly used as a verb to describe the action of applying a force that causes twisting. Use this picture as an example. When enough torque force is applied to the end of the wrench, the forces holding the bolt stationary will be overcome and the bolt will rotate. This happens all the time in our bodies, and when the motion occurs at joints, we have given it different names depending on which axis the rotation is occurring around. For example, flexion and extension occur around a transverse axis due to a torque force applied in the sagittal plane. The number of axes and planes of motion that can be simultaneously acted upon by torque forces at a single joint will depend on the shape of that joint. So for a typical vertebra, we may see a combination of flexion and extension, rotation, and side bending, each in their own plane around their own axis. But if we were palpating the joint as it moved in all those planes at once, it would feel just like one smooth motion. In the human body, our joints are surrounded by and connected to other structures by ligaments, tendons, other fascial connections, and even fluid. This makes for a much more complicated picture than a torque force applied to a wrench to turn a bolt. When a torque force acts on a human body, it may act upon the body as a whole or on its parts. A single torque force might exert any number of effects on different parts near and far, depending on the composition of the tissues in the parts and the connections between the parts. While some methods of osteopathic diagnosis and treatment of somatic dysfunction are joint-centric, articular dysfunctions seldom exist in isolation, and sometimes they are merely secondary to dysfunction in one or more connected parts. Dr. Wallace has devised a system for diagnosing and treating somatic dysfunction in what she terms the torque system. She does this by dividing the body up into a series of cubes and cylinders and looking for what she calls torque balance points. For any cube or cylinder that has a dysfunction of Wallace's torque system, there will be a pair of torque balance points. To locate these points, Wallace recommends first locating the point that is maximally deviated from the center of the cube or cylinder and noting its position relative to the height, width, and depth of the cube or cylinder. The corresponding point will be diametrically opposite. That is to say, they will be equal and opposite of each other on the surface of the cube or cylinder. According to Dr. Wallace's method, think of the cranium as a cube and divide it up into left and right, anterior and posterior, superior and inferior. However far from the mid-sagittal, transverse, and coronal lines your first point was, that's how far away, but on the opposite sides, the corresponding point will be. The body does not contain any perfect cubes and cylinders, so getting precise measurements is not feasible. I am not aware of Dr. Wallace describing the quality of the points, but I have found that they are not discrete like Chapman points or trigger points. They are more of an area that is bowed out or sunk in. Let's watch a video showing how I find torque balance point pairs. I'm not going to discuss Dr. Wallace's torque system in depth. Suffice it to say that a pair of torque balance points found in one cube or cylinder should be present in the other cubes and cylinders. So if we found a bowed out point on the right anterior superior head, we would also expect to find a bowed out point on the right anterior superior rib cage and pelvis. To treat Dr. Wallace's torque system, you should address all the torque balance points in the different cubes and cylinders. Wallace described three methods to treat the torque balance point dysfunctions. One she describes as wrapping around the point. which is a myofascial release technique that repositions the body parts in order to wrap around the torque balance points. This method may require 1 or 2 people depending on the location of the points and the relative size of the patient and person treating. The time needed to treat depends on the time needed to precisely wrap the body around the points. The second method Wallace refers to by a few names: point unwinding or torque unwinding, or the screwdriver technique. This can be done by one person and is a myofascial unwinding technique that involves rotating one point clockwise or counterclockwise in the direction that achieves maximal ease at both that point and the corresponding point. Then hold that position while rotating the corresponding point to a point of even further ease felt at both points. The time needed to treat depends on the time needed to precisely rotate both points to maximal ease and any unwinding that may occur. The third method Wallace calls the bounce technique, and it is a pulse technique where the operator's fingers bounce a force from one point towards the corresponding point. She describes it as shooting an arrow through 2 points and says the force must be specific or it won't work. Time needed to treat is how long it takes to accurately pulse a sufficient force from one point through the other. Now let me show you how I treat torque balance points. Let me break that down for you. First, push against the point to engage the cube or cylinder. Then rapidly twist the point clockwise and counterclockwise. It doesn't matter which way you twist first. Then rapidly twist the corresponding point both directions. You should immediately feel the bowed out point settle back in towards the body and the sunk in point spread outwards. This is a rotary soft tissue technique applied to specific points, and the time needed to treat is 2 seconds or less. Another advantage to this method is that diagnosis and treatment can be combined. I'll show you what I mean. First, find that bowed out point. For him, it's superior, posterior on the left. I'm going to put my other hand on the opposite side, so the right side inferior and a little bit anterior. I'm just monitoring the side at the moment. Now I push in with my left hand against that bowed out point. I want to feel like I'm pushing against it in such a way that there's this vector force in his head pushing directly straight out against the way I'm pushing into his head. There I have it. So I've engaged that point. Now I can just twist with my left hand. I felt under my right hand it twisting right about there. So I move so I get my fingers right on it, because usually with the sunken in point you have to push with a little bit more force than with the bowed out point. So now I can push in where I felt the twisting. To engage it, twist, twist. Release should be immediate. When I do it, not having to talk things through and explain it, it's much more rapid than that. It probably looks a little bit more like this. There you have it. I have been experimenting with other ways to use this torque soft tissue technique, and I have found it can be used to treat other paired myofascial dysfunctions. I have made this video as a resource for other physicians and body workers. Do not attempt to perform any manual techniques unless you are a physician or body worker or a student under proper supervision.